Good afternoon, everyone. My name is Tricia D'Agostino. I'm an elder law attorney at Margolis Bloom & D'Agostino. Thank you for joining us today. For those of you who don't know, our firm specializes in estate planning, elder law, and special needs planning. So we do a lot of work around mass health applications, enrollment, and eligibility, but what we aren't experts in is anything in Medicare enrollment and eligibility. And so we're very glad to have Lori Howell here today, who is Lori owns Howell Medicare Advisors, and she can help people with the process of determining what type of Medicare coverage they need, whether it's Part A, Part B, a Medicare supplement, Medicare Advantage plans, Part D prescription drug coverage. She helps people turning 65 and that are newly eligible figure out what plan is appropriate. She also does a lot of work for clients to review their plans during the Medicare open enrollment period, which is actually now. It's October 15th through December 7th. So she can review a client's plan to see, are they on the right program? Is there anything that might be a better fit for them? So we're very fortunate to have Lori here today to tell us all the things that we need to know about Medicare. So I'll turn it over to Lori, and thank you for joining us. I do want to just say we have a lot of people on today. So we're going to hold all questions to the end. If you can put them into the question box, I'll monitor those and we'll get to them if we can at the end of the presentation. Thanks so much. Thank you, Lori.
Great. Thank you, Tricia. And what an excellent introduction. I can't say more about myself than what Tricia has already said. So I do have a lot of information I want to get through today. So let's go ahead and get started. So what is Medicare? Medicare is health insurance that's subsidized by the federal government. So it's for people who are 65 and older, people who are under 65 with certain disabilities, such as end-stage renal disease or ALS. In 2023, there's going to be the option for people who are on immunosuppressive drugs to just enroll in Part B of Medicare, so they continue on with that coverage. A lot of immunosuppressive drugs are covered by Part B of Medicare, so that's going to help out a lot of people. The eligibility age for Medicare is age 65. Oftentimes people confuse that with the eligibility age for Social Security and the full retirement age for Social Security. So Medicare, the eligibility age is always 65 for people who are aging into the Medicare realm versus under 65 for people who have certain disabilities. Medicare consists of Part A, B, C, and D. You would think that all of those plans put together would give you comprehensive coverage, but that's not how Medicare works. Not all the parts work with each other for comprehensive coverage. Medicare is also different than Medicaid. Oftentimes people get confused. Oh, they'll say, I have Medicare or Medicaid. No, Medicaid is for people who are have limited income and assets to help pay for some of their health care costs. So I'd like to show this picture to people because back in 2018, Medicare changed the format of your Medicare card. So if you happen to have enrolled in Medicare prior to 2018 and maybe delayed enrolling in Medicare Part B, you may have the original card that has your Social Security number listed on it. Those cards are no longer being used. So please, if you have a Medicare card, check to make sure that your Social Security number is not listed on it anymore. In 2018, Medicare started using randomly generated numbers to protect people from identity theft and fraud. So please, check your Medicare cards just to make sure you have the updated format. So we'll discuss the 4 parts of Medicare. And how they interact with each other, and go into a little more detail on each of the parts and what they do. So Part A of Medicare is the inpatient hospital coverage. If you're admitted into the hospital, you should check to make sure you're classified as an inpatient. There's ramifications if you're not. If you are transferred over to skilled nursing, you have to have a 3-day inpatient hospital stay for skilled nursing care to be covered under Part A of Medicare. So think of Part A as inpatient hospital coverage. Part B is medical coverage. So if you are considered an outpatient or for your doctor's visits or medical testing, those are covered under Part B of Medicare. And Part A and B together are termed as original Medicare. So when you hear people say, oh, I have original Medicare, they mean they have Part A and Part B of Medicare. Then Part A and Part B of Medicare isn't comprehensive coverage, so then new parts were added on. Part C of Medicare is an umbrella term. There are a number of plans that fall under Part C of Medicare, and these are all plans offered by private insurance companies. So unlike Part A and Part B, where there's just Part A, there's just Part B, and those are controlled by Medicare, Part C plans and Part D plans are all private insurance plans, and there are a number of options available to people. Part C, also called Medicare Advantage plans, are typically bundled plans where you have a network of doctors, hospitals, prescriptions, and some extras all bundled together in one package. They're network-based HMOs and PPOs, so you do have to be careful to make sure that your current physicians, current providers, current facilities are all within the network of the plan that you're looking at, and that your prescriptions are covered. So we're going to go into that in a little more detail too. Part D is just prescription coverage. So once again, there's a number of different insurance companies offering plans under the Part D umbrella. You really need to look at each individual plan that's offered to make sure your particular prescriptions are covered under that plan. So once again, Part A plus Part B plus Part C plus Part D do not all go together. Part C and Part D do not work together. You can either have one or the other. If you enroll in a Part D plan, they'll automatically kick you out of a Part C plan if you've been enrolled in that. So people have to be very careful. You have to have Part A and Part B original Medicare to have access to Part C and Part D. Part C Medicare Advantage plans, those are the plans that you see advertised frequently on TV nowadays, saying that you get the benefits you deserve. There are additional coverages such as dental, hearing, and vision with a Medicare Advantage plan, but you still need to determine if that's really the best fit for you, because there is limited networks and there are restrictions when you're in a Medicare Advantage plan. So original Medicare Part A and Part B, once again, does not have comprehensive coverage. So there is actually another option for people outside of the Part A, B, C, and D for people to get more comprehensive coverage, and those are called Medicare supplement plans, also known as Medigap plans. The Medigap plans are also offered by private insurance companies, and there's a number of different plans offered with different levels of coverage. So you really need to look at all your options to know what is the best Medicare coverage for you. So this is one of the questions I get asked quite often. Isn't Medicare free? Unfortunately, no and yes. So Medicare Part A has no cost to it if you've contributed 40 quarters working towards Social Security. If you've worked less than 40 quarters, then there are monthly premium costs based on the number of quarters you've worked contributing to Social Security. Part B, the medical portion of Medicare, always has a monthly premium. The monthly premium is determined by a 2-year look back to your income taxes that you filed. So for 2022, Social Security and the IRS are looking at your 2020 tax return to determine how much your Medicare Part B premium will be. And if you are considered a higher income, there's a range of different levels and thresholds, and you may pay more for your Medicare Part B than the standard rates. So for 2023, recently the numbers were released for 2023. Part A, the hospital coverage, there's a $1,600 per benefit period deductible. So what that means is with a benefit period, it's not an annual deductible. There could be multiple benefit periods within a calendar year. A benefit period starts when you've been admitted to the hospital. A benefit period ends once you've been discharged from the hospital and home for 60 consecutive days. That's when the benefit period ends. So if perchance On day 62 of you being home and something happens and you're admitted to the hospital again, that starts another Medicare Part A benefit period, and you'd be assessed another $1,600 Part A deductible that has to be met. Part B, the standard monthly premium for 2023 is $164.90 a month. That's actually down from last year. Last year is this year is $170.10 a month. So they've made some adjustments so that you're going to pay less for your Medicare Part B premium in 2023. And then once again, if you are considered higher income, you will be assessed what's called the income related monthly adjustment amount. This is in addition to the $164.90 monthly premium. So there's different threshold levels. They're going to look at your income, and then based on what threshold level you are in, you're going to be assessed an additional charge for your Part B premium. The Part B also has a deductible, but it's an annual deductible. In 2023, it's going to be $226. So typically, the first time you go to a doctor, they'll bill Medicare. Medicare will say, okay, we're going to pay everything except the first $226, and then you will be billed that $226. The Medicare Advantage and Part D plans, once again, there's a number of different plans available to you. What plans are available are based on your zip code and county that you live in. So not every county in Massachusetts has the same plans available to them. So you have to be careful to see which plans are available in your area so that you don't choose a plan that won't provide you coverage. These plans, once again, are offered by private insurance companies, so they have different monthly premiums and co-pays, in particular with Part D and Part C plans. Also, we have the Medigap plan. So the Medigap plans work with Original Medicare Part A and B to provide more comprehensive coverage if you don't go with a Medicare Advantage plan. So typically people either go with Original Medicare Part A and B with a Medicare supplement plan and a prescription drug plan, or the other route to get your coverage is Medicare A and B with a Medicare Advantage plan. So the Medigap plans, once again, offered by different private insurance companies. They have different premium costs, so you really have to look at the levels of coverage to know what is the best plan for you and what the cost of that plan will be. So I like to show things graphically, visually for people to try to get an idea of the different ways to get your Medicare coverage. So it's an either or situation. You either get your coverage for Medicare through Medicare Part A and Part B with a Part D prescription drug plan. Now, once again, Part A and Part B is not comprehensive coverage. So many people purchase a Medigap plan that we say wraps around Medicare Part A and B to give you more comprehensive coverage. So I like to think of it as putting together a layer cake. You have the different layers. Part A, your hospital coverage. Part B, your medical coverage. Part D is your prescription drug coverage. And then the Medigap plan works as a frosting over the cake. It's a layer cake, so it's pretty big in size. It can carry with you, it can cover a wider area. If you have Original Medicare with a Medigap plan, you can go to any doctor that accepts Medicare. You can go to any hospital that accepts Medicare. There's no networks, travels with you throughout the country. So it's really a more robust area coverage for you. Medicare Advantage plans, I try to think of those as more like a Hostess cupcake. It's smaller, it has all the same ingredients and parts of Medicare combined together, has some extras like the cream inside, like dental, hearing, and vision, but it's smaller, so it doesn't cover as much. So it is confined usually to the area where you reside. You have to stay within the network of doctors and hospitals. There are HMOs and PPOs. So with a PPO, you can go outside the network, but you still have to be very careful because not all doctors would accept it. Even if it's a PPO, the doctor still has to accept your plan. So you just have to be more careful with a Medicare Advantage plan. So let's go into a little more detail about the Medicare supplements, the Medigap plans. So once again, they provide coverage in addition to Medicare A and B. There's different levels of coverage with different deductibles and co-insurance depending on the insurance company and the plan that they're offering. Even if you have a Medicare Advantage plan, you still have to pay the Medicare Part B premium. You always have to pay that, even with a Medicare Advantage plan. Everyone has to pay the Medicare Part B premium. The Medigap plans typically do not include dental, hearing, or vision, but some of them you can have additional riders that will add that coverage for you. The premiums are based on the offerings from different insurance companies. So different insurance companies will have different rates for similar coverage. Once again, the Medigap plans do not include prescription drug coverage, so you have to enroll in a Medicare Part D plan to get your prescription drug coverage. Now, one thing that is sort of a Medicare gotcha is that the rules for Medicare supplement plans, Medigap plans, vary by state. So we're fortunate in Massachusetts, we have very lenient rules for when you can get a Medigap supplement plan. Other states do not have those rules and are much stricter. So when you enroll in Medicare Part A and B, that's called your Medicare open enrollment period. For the first 6 months after you get Medicare A and B, you can purchase any Medigap plan that's offered. After the 6 months, in most other states, Medigap plan does not have to sell you a Medigap plan. Medicare insurance company does not have to sell you a Medigap plan, and they can put you through medical underwriting, which could either deny you coverage or raise your monthly premium. So in Massachusetts, we don't have that issue, but other states do. So if you should get a Medigap plan in Massachusetts, know that you can continue that plan even if you move out of state. You do not have to purchase a Medigap plan from another state. So that's an important thing to keep in mind. So in Massachusetts, we have 3 different levels of coverage. Other states have much more. So this makes it a little easier for people in Massachusetts. Starting January 1st, 2020, we have the 3 options. Prior to that, we only had 2 options. The options are Core, which is the most basic level, doesn't provide all the coverage that the other 2 supplement levels do. Supplement 1 plan is only available to people who were eligible for Medicare prior to January 1st, 2020. So if you are turning 65 or have turned 65 after January 1st, 2020, you do not have access to the Supplement 1 plan. After January 1st, 2020, we now have Supplement 1A plans, which are very comprehensive. The only difference between the Supplement 1A plan and the Supplement 1 plan is that the Supplement 1A plan does not cover the Part B deductible, which is going to be $226 in 2023. That's the only difference between the plans. The Supplement 1A plan does tend to have lower monthly premiums, so they do prove to be just as cost effective than the Supplement 1 plans. Once again, these are all levels of coverage that are offered by different insurance companies. So the Supplement 1 plan, any insurance company offering a Supplement 1 plan has the exact same coverage, no matter what insurance company is offering it. So that's why you really need to price compare to look at the different costs of these plans to make sure you're getting the most cost-effective coverage. So once again, this is talking about the change that was effective January 1st, 2020, where only certain levels of coverage are offered after that date. In Massachusetts, it's the Supplement 1 plan is no longer offered for people who are turning 65 after January 1st, 2020. In other states, they're labeled Plan F and Plan C. In other states, their plans are labeled differently and they have a larger range of options. They go from Plan A through Plan N, and there are different levels of coverage, but we don't have those same plans. Massachusetts is the only state that has the core Supplement 1 and Supplement 1A options available. So for the Medicare supplement plans in 2023, there's 24 different plan options available in Massachusetts. They're all by the major insurance companies, plus Blue Cross Blue Shield of Massachusetts and Fallon. Harvard, Pilgrim, and Tufts have merged to one company, but for 2023, they're still offering Medigap supplement plans under each individual name, Harvard, Pilgrim, or Tufts. United Healthcare is the insurance company for AARP. So if you have an AARP plan, it's United Healthcare is the insurance company. The range in prices for these plans is pretty wide, but the core level plans typically are the most least expensive, where the Supplement 1 plans are the most expensive. Once again, the only difference between the Supplement 1 plan and the Supplement 1A plan is that the Supplement 1 plan covers the $226 Part B deductible. That's the only difference between the two levels of coverage. And the Medigap plans do not have prescription drug coverage, so you have to enroll in a Part D prescription drug plan for that. So this is just an example of all the plans that are available in Connecticut. I was trying to put Texas on, but I couldn't put that all on one screen. So as you can see, they have the plans are labeled A through N, and they're offered by multiple insurance companies, and there's multiple prices based on which plan letter you choose from. So in Massachusetts, the Supplement 1 plan is comparable to a Plan F in other states, and a Supplement 1A plan in Massachusetts is comparable to Plan G in other states. So we're going to talk about the Part D prescription drug plans now. So once again, there is no just one Part D plan. There's multiple Part D plans offered by multiple insurance companies. They all have different premiums, deductibles, co-pays. They have different lists of prescriptions that are covered by the plan. So it's very important to look at all the plans that are available to make sure that your particular prescriptions are covered under that plan. The plan that works best for you might not necessarily work best for your spouse. So you really need to look at the options to make sure that you are using the plans in the most cost-effective way. The plan's monthly premium, the lowest monthly premium in 2023 is going to be $6.08 a month. The most expensive plan in Massachusetts is $125 a month. So there's a wide range of plans that are available, but the goal is to get the coverage that you need at the most cost-effective rate. The highest deductible, some of these plans have deductibles before you see some cost savings in your out-of-pocket costs. The highest deductible in 2023 is $505. There are some plans that have a $0 deductible. Those plans do tend to have a higher monthly premium though. Each plan has typically 3 to 4 phases of coverage. So Medicare is tracking the retail cost of your prescriptions, so not what you're paying out of pocket, but the full retail cost of your prescriptions to determine what phase of coverage you're in for your prescription drug plan. So that's why your out-of-pocket costs can fluctuate during the year based on what phase of coverage you are in. The coverage gap was formerly known as the donut hole, still exists. It's not as drastic as it had been in the past because the insurance companies are now helping to pay for some of your costs, but during the course of the year, your medications, the out-of-pocket costs can fluctuate greatly depending on what phase of coverage you are in. And how do you select a Part D plan? It's based on your list of current prescriptions. You want to find the plan that has the most cost-effective coverage with the lowest monthly premium. Just because a plan has a very high monthly premium doesn't necessarily mean that it will cover your prescription. So we really have to be careful and looking at the formularies of the plans to make sure your prescriptions are covered. Some of the plans have requirements for you to get prior authorization from the plan before they'll cover a particular prescription, or step therapy, meaning that they're going to have you try out different medicines before they will let you get your particular medicine to make sure that if there's a less expensive medication that might work better for you, they want you to try that first. But these are some things that your doctors or your prescribing providers can help you submit paperwork to the plans to ask for the prior authorizations or potentially to waive the step therapy. So once again, the plans are, particular individualized plans. So you really need to be careful to look to make sure it's the most cost-effective plan for you that covers your prescriptions. So these are some of the plans. In Massachusetts, there's 24 prescription drug plans on average. In most counties offered in Massachusetts, the monthly premiums range from $6.80 to $126.60. If you are assessed the IRMA, which is the additional charge for people who are deemed higher income, they actually have an additional surcharge for your prescription drug coverage that needs to be added to that too. Many of the large insurance companies are offering plans in Massachusetts. We have Aetna, Blue Cross Blue Shield, United Healthcare. A new insurance companies come on the market for 2023, Clear Spring Health. So they're new to the market, so they're have lower price plans because they're trying to get some business. But you still need to make sure that your prescriptions are covered by them. I have Cigna highlighted in red because there's a certain gotcha that's going on in 2023. In 2022, Cigna offered a plan that many people enrolled into, which is being discontinued in 2023. So those folks that are on that plan are automatically being switched to another Cigna plan. It happens to be their most expensive plan. Cigna did not do any analysis work to see if that plan is more cost effective for people. They're just automatically dropping into that. Unfortunately, Cigna has offered a new plan, which is 50% the price of the plan that they're automatically assigning people to, which may be more cost effective for people. So people really need to review their plans. This is Medicare open enrollment. Review their plans to make sure that they are not being automatically placed in a plan that's not the best fit for them. So now we're going to concentrate on Medicare Advantage plans. So this is the other route for your coverage. Medicare Advantage plans have your Part A, your Part B, your prescription drug coverage, and some extras such as dental, hearing, and vision potentially added to them. There are HMOs and PPOs, so you do have to be mindful of networks. They do oftentimes require referrals to see specialists. So with a Medicare Advantage plan, you just have to be more careful with your coverage to make sure that you're following the rules of the plans. The Medicare Advantage plans typically are regional based or based in a certain area, so they don't necessarily travel well. Some plans do let you have access to networks outside of your area. So for example, if you're a snowbird and you have a Medicare Advantage plan, you really need to check with the plan to see if you'll have coverage outside Massachusetts and in Florida. Many of the plans would not provide you with that coverage. Unlike a Medicare supplement plan with Part A and Part B original Medicare, you can go to any doctor that accepts Medicare, any hospital that accepts Medicare. So with the Medicare Advantage plan, you just have to be a little more careful. So Medicare Advantage plans, again, they're under the umbrella of Part C of Medicare. They're offered by private insurance companies. You have to check with your doctors to make sure they accept the plan that you're looking into. Many of the doctors' offices don't refer to Medicare Advantage plans as Medicare Advantage plans. They call them Medicare replacement plans. So if you're asking, a physician if they cover your they accept your Medicare Advantage plan, you might want to use what Medicare replacement plans do you accept. The benefits must be equal to or greater than original Medicare. You don't lose any benefits by purchasing a Medicare Advantage plan, but there are more restrictions applied to a Medicare Advantage plan. So such as you need a referral, you have to stay within the network, you need prior authorizations for some procedures. There are a number of different plans often offered. They have different premiums, different deductibles, different co-pays. So you really need to look at the details of the plans to see if they are a good fit for you. One good thing about the Medicare Advantage plans is that they do have maximum out-of-pocket limits. So this would limit how much you would pay out-of-pocket on a given year. You can look at sort of your risk exposure every year. So for Medicare Advantage HMO plans, the maximum out-of-pocket is capped at $8,300. For a Medicare Advantage PPO plan, the maximum out-of-pocket cap is $12,450. Now, the plans can decide to lower that cap, but once again, it's one of those details that you really need to look at when you're in a Medicare Advantage plan. And along with Medicare, original Medicare with a supplement plan, you still have to pay your Part B premium to be enrolled in Medicare and to have a Medicare Advantage plan. So the premium for your Medicare Advantage plan would be on top of the Part B premium that you have to pay. So once again, typical plan designs are HMOs, PPOs. There are some medical savings advantage plans. Those are very limited. So just be aware of what type of plan you're looking in so that you know how to work with your plan to get the coverage that you need. So once again, the Medicare Advantage plans, what plans are available to you are based on your zip code and county that you reside in. Some plans do not offer prescription coverage, so you have to be very careful of that. You want to have prescription coverage so you are not assessed a Part D late enrollment penalty if you need one in the future, and you want to have prescription drug coverage. If you have VA prescription coverage, you don't have to enroll in Medicare Advantage plan with prescription coverage. You can use the VA system for your prescriptions. In 2023, there's 47 different Medicare Advantage plans offered in each county in Massachusetts. Some plans are offered in Western Mass that are not offered in the Boston area. So you really have to base it on what county you live in and your zip code to know which plans are available to you. So these are some of the insurance companies that are offering the plans in 2023. The big companies, Tufts, Aetna, Humana, Harvard Pilgrim is not offering Medicare Advantage plans anymore because of their merger with Tufts. Tufts is offering a PPO plan for the first time this year. They were typically always HMO plans, but I think as a result of the merger that they're now offering a PPO plan. And also plans are now being offered by Brigham and Women's Hospital, but those are mostly in the Boston, Norfolk, Suffolk county areas. So once again, the plans have different options for you, different coverages, different monthly premiums. So we really need to look at the details of the plans to make sure it's a good fit for you. This is an example of some of the out-of-pocket costs that you may have with a Medicare Advantage plan. Medicare Advantage plans do tend to have lower monthly premiums as compared to Medicare supplement plans, but you have out-of-pocket costs with a Medicare Advantage plan. So every time you go to the doctor, you have a copay. Every time you have a test, you have a copay. And sometimes you have co-insurance. So copays are flat dollar amounts that are assigned to different procedures. Co-insurance is usually percentages of a cost. So just be mindful of the different ways that the payments are made. Copays, once again, flat dollar. Co-insurance is a percentage of the cost that you have to pay. So how do you choose which path to go? Once again, it's an either-or situation. You either go with original Medicare with a supplement plan and a Part D plan, or you go to the Medicare Advantage plan route. So these are some of the things you have to think of when you're considering the different ways to go with Medicare. Do you travel? Do you travel outside the country? If you are a snowbird, are you out of the area for a certain length of time? Medicare Advantage plan might not be the best fit for you. Medicare Advantage plans will not cover you outside the country, where Medicare supplement plans, some levels of coverage do give you foreign travel coverage. Are you cost sensitive? Do you need to have a lower monthly premium? Well, Medicare Advantage plans tend to have lower monthly premiums, but there are out-of-pocket costs associated with that. Medicare supplement plans and Medigap plans have higher monthly premiums, but you have to think of it sort of like as prepaying for your healthcare coverage. So there are many different aspects when you're considering what is the best Medicare coverage for you. So just to compare some of the issues with Medicare Advantage plan versus Medicare supplement plan. So once again, Medicare Advantage plans do tend to have lower monthly premiums. They have co-pays for their services. It has guaranteed issue, which means anyone can purchase a Medicare Advantage plan. They cannot ask you any medical questions. They cannot raise the price on you if you have any medical issues. Everyone pays the same rate. They're for certain geographical areas. Most include prescription drug coverage, and some have additional coverage such as dental, vision, and hearing. Medicare supplement plans do tend to have higher monthly premiums, but you do not have the out-of-pocket costs. You do not have the co-pays or the co-insurance. It's usually once you've paid your monthly premium, then that's all your out-of-pocket costs for the year for anything that Medicare covers. In Massachusetts, we have guaranteed issue for the Medicare supplement plans. That means everyone pays the same rate, whether you're male, female. They cannot ask you any medical questions. They cannot deny selling you a Medigap supplement plan or charge you higher if you have a medical condition that they're concerned about. That is not the same as every state. This is something in particular with Massachusetts. With the supplement plan, there's no networks you have to worry about. There's no referrals. You can go to any doctor that accepts Medicare, any hospital that accepts Medicare. The Medigap plans do not have prescription drug coverage, so you do have to enroll in a separate prescription drug plan. Medicare does not cover dental, vision, or hearing. Some supplement plans, you can add that coverage for additional cost. And some of the supplement plans do have coverage for foreign travel. So these are some of the common mistakes when people are looking at all their options. They want you, if you're looking for a Medicare Advantage plan, it's very important to make sure all your doctors and providers are in the network to keep your costs down. Not all doctors have to accept all plans. So there have been occasions when someone has gone to the hospital and the hospital is in network for their plan, but not every doctor within the hospital is on the plan, the Medicare Advantage plan. So that's something you really have to be mindful of. Then does it cover your prescriptions? That's very important too. You don't want to have a Medicare Advantage plan if it does not cover your prescriptions. There are other options potentially out there that would cover, provide better cover for your prescriptions. And then, you know, when you're looking at Part D prescription drug plans, once again, are all your medications covered? Is there a preferred pharmacy that you want to work with? Is that pharmacy in network for the plan so that you get cost savings? And are there any restrictions on your medication, such as prior authorizations or step therapy? So we're going to talk about some of the potential missteps to avoid. There's a number of different things that can cause problems for people who are enrolling in Medicare. We're going to touch on some of these issues. Everyone has heard that you need to enroll in Medicare when you turn 65. That's not necessarily the case. If you are still actively working and you're covered by the employer health plan through that active employment, you may be able to delay enrolling in Medicare. If the company has more than 20 employees, you can delay enrolling in Medicare until you retire or lose coverage, and you won't face any penalties. So we're going to discuss the income-related monthly adjustment amount, IRMA. That's the amount for people who are considered higher income. There's different thresholds of levels of how much someone has to pay in addition to the standard Part B premium, which for 2023 is $164.90. There's actually another surcharge that is added to the prescription drug portion of your coverage too. So there's two surcharges, the IRMA for your Part B premium and then an IRMA surcharge for the prescription drug portion of your coverage. So this is determined by Social Security and the IRS, how much you are going to pay for your Part B premium. There are ways to have this IRMA redetermined. So if you retire, you can ask them to look at your income the year of your retirement, which would truly reflect your income going forward, so they can make adjustments and reduce your IRMA amount if that's applied to you. So here's the chart of the IRMA expenses for 2023. And these are called cliff thresholds. So if you're just $1 over the amounts listed, that moves you into the next threshold. So, you know, if you can look, estimate what your 2020, they're looking at, for 2023, they're looking at your 2021 income level to determine your IRMA amount. So if you can estimate what your 2021 income was and refer to this chart, you can get an idea of what your monthly Part B premium will be and the Part D surcharge that will be added. There are plans available to people on Medicare who have limited income and limited assets to help defray some of the costs of Medicare. They are administered through Mass Health in Massachusetts. These Medicare saving programs are administered through the Medicaid programs of each state. So in Massachusetts, our Medicaid is called Mass Health. So based on your income and assets and your living situation, you may be able to get help defraying some of the costs of your Medicare, such as your Part B premium, any deductibles, any co-insurance, any co-pays. So this is something that many people are not taking advantage of. So I wanted to put this out there for folks who may find help paying for some of their Medicare costs. So when should you enroll in Medicare? If you are collecting Social Security prior to the age 65, you will be automatically enrolled in Medicare Part A and B, and it will become effective the first of the month that you turn 65. You do not need to do anything. If you are not collecting Social Security prior to 65, then it's on you to reach out to Social Security and Medicare to enroll in Medicare. Medicare and Social Security is not going to reach out to you and say, oh, you're turning 65, it's time to enroll. They put it on you to submit your application for Medicare. So once again, if you are still actively working, you're covered by the employer plan from that active employment, and there's more than 20 employees, you do not need to enroll in Medicare when you turn 65. You can delay enrolling in Medicare, and you're protected by your employer plan from being assessed any late enrollment penalties. When you do decide to enroll in Medicare, you'll be given a special enrollment period to submit your application for Medicare Part A and B. People who are receiving Social Security Disability Insurance, SSDI, for 25 months will automatically be enrolled in Medicare also. So those folks don't have to do anything either. On the 25th month, they'll be automatically enrolled in Medicare, even if they're under the age of 65. So when you're turning 65, you have what's known as your initial enrollment period. So that includes 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So if you submit your application for Medicare in the 3 months prior to your 65th birthday, your Medicare coverage will begin the first day of the month that you turn 65. If you delay enrolling into Medicare any of the 4 months, including the month that you turn 65, then your Medicare coverage will be bumped out 1 month. This is a new rule starting in 2023. Prior to that, your Medicare effective dates could be bumped out to at least 6 months out, and that caused people to have some gaps in coverage and problems. So they're trying to fix that, and in 2023, when you apply for Medicare after the month of your birthday, your Medicare will become effective the first of the following month that you apply. So once again, delay in enrolling in Medicare, you do not necessarily have to enroll in Medicare Part A and B when you are still working, actively employed, and covered by the employer health plan of that active employee. It could be you or your spouse. You both are covered. As a spouse, you get the same protections. Unfortunately, if you are not married and you have a domestic partner who is covered under your employer plan with you, when they turn 65, they must enroll in Medicare. They do not get the same protections as a spouse. So I want to make sure people are aware of that. If your company has less than 20 employees, then you need to enroll in Medicare when you turn 65, because Medicare would become your primary coverage and your employer coverage would become secondary to that. If you miss your initial enrollment period, so that's the 7-month window before and after you turn 65, and you should have enrolled in Medicare, there is another opportunity to do so. It's the general enrollment period, and it's January 1st through March 31st every year. And if you enroll at that time, your Medicare coverage will begin the first of the next month. That's another rule that's changed for 2023. Prior to that, if you enrolled in Medicare in January 1st through March 3rd during the general enrollment period, your Medicare would not have become effective until July 1st. So that was a large gap from a lot of people. So they've rectified that situation starting in 2023. So Medicare supplement plans, this is something I touched on before. It doesn't impact us in Massachusetts, but other states have this rule where if you do not enroll in a Medicare supplement plan, a Medigap plan, within the first 6 months of having both Medicare Part A and B, you can then go through medical underwriting when you do try to purchase a Medigap supplement plan, and the insurance company can either deny selling you a plan, or they could put you in a waiting period or increase the monthly premium based on any medical conditions they decide to cover and apply to the Medicare supplement plan coverage. Part B, late enrollment penalty. So if you are Medicare eligible, you are not covered by an employer plan through active employment. If you are covered under COBRA, COBRA is not considered active employment, so does not protect you from the Part B late enrollment penalty. So if you then try to enroll in Medicare Part B later down the road, you will be assessed a lifetime Part B late enrollment penalty, which is cumulative. So for every 12 months that you did not enroll in Medicare, and you should have, you will be assessed a 10% Part B penalty based on how many 12-month periods you should have had Medicare. So for example, if you should have enrolled in Medicare 2 years ago, and now you're deciding to enroll in Medicare, you'll have a 20% Part B penalty for your lifetime. And the Part B penalty will be based on the monthly premium, the Part B monthly premium for that year. So for 2023, the Part B premium is $164.90. There's going to be a 20% penalty to that amount. So an additional $32.98 a month would be added to your Part B premium for the year of 2023. And that will change every year based on what the Part B premium is for that year. And there's no way to get out of this lifetime penalty. The only way you could do that is if you could prove that you were given misinformation from a Social Security representative. They're trying to change some of that to make it easier for people to fight the lifetime penalty if you were given misinformation by a person in the benefits department of your employer, but that's not in place yet. So another common statement I hear is, I don't take any prescriptions. Why do I need to enroll in a prescription drug plan? Because if you do not have creditable prescription drug coverage, you will be assessed a Part D late enrollment penalty, which is, again, another lifetime penalty. It's 1% for every month that you should have had prescription drug coverage. And that 1% is added to the monthly premium for your plan. And once again, if you're given misinformation, you may be able to have the penalty waived, but it's very rare that that happens. If you do have creditable prescription drug coverage, meaning just as good as Medicare, you can delay enrolling in Part D prescription drug plan until you no longer have that option, or if you want to enroll in a Part D plan later on, you're protected if you have creditable prescription drug coverage, such as the VA pharmacy benefit or group plan or COBRA. It's one of the few times that COBRA coverage is not held against you when it comes to Medicare. So does Medicare cover everything? No, unfortunately, Medicare does not cover everything. It does not cover dental, hearing, and vision. There is legislation that's going through that's trying to provide more dental coverage for people on Medicare. And there's recently been legislation passed where hearing aids are now going to be considered over the counter for some people, so it might help with some of the costs for hearing aids. Medicare does not cover an annual physical. Anything deemed cosmetic or any coverage in a long-term care facility or assisted living, Medicare does not help with the cost for those. People have to be careful on Medicare with the word annual physical exam. Medicare does not cover a physical exam annually. So if you want to go see your doctor, you have to tell them that you're there for your annual wellness exam, and they will bill it accordingly to what Medicare coverage. So another thing that people have to look out for on Medicare is if they are contributing to health savings accounts. When you're enrolled in Medicare Part A or B, you can no longer contribute to a health savings account. So if you are considering delaying enrolling in Medicare, when you do decide to enroll in Medicare, make sure you stop contributing to a health savings account 6 months prior, because your Medicare Part A will go back retroactively 6 months when you do enroll in Medicare. If you have made contributions to a health savings account, that money that is in there when you are Medicare eligible will be treated as ordinary income. So you'll have a tax penalty on that. There's a lot of problems with people on COBRA. COBRA and Medicare do not interact well. If you are on COBRA, that's not considered active employment, so you're not given the same protection. So once you've lost your employer coverage, you have 8 months to enroll in Medicare Part A and B. After that, you'll start to be assessed a late enrollment penalty. Now, many people will pick up COBRA thinking that that's your healthcare coverage, you're protected from being assessed on penalties. That's not the case because a COBRA is not considered active coverage from active employment. And then another issue is the actual COBRA insurance companies. If they know that you were eligible for Medicare and did not enroll, they will not cover anything that Medicare should have covered because Medicare is primary to COBRA. So if you did not enroll in Medicare while on COBRA, they're going to have you pay what Medicare would have covered, and COBRA would pick up the rest for you. So people on COBRA need to be very careful with the timing of Medicare enrollment and being eligible for Medicare. And more recently, I wanted to touch upon this. The Inflation Reduction Act has given some provisions to help defray some of the cost of people's prescription drug coverage. Unfortunately, not all the provisions are taking place immediately. For 2023, the major provision is that it's reducing people's insulin costs on Part D plans to $35 a month, which is great because the insulin products can be very expensive for people. Unfortunately, this act wasn't passed before the Part D insurance companies submitted their files for their 2023 cost. So if you're looking on Medicare.gov to try to determine what is the best prescription drug plan for you for 2023, it's not going to reflect the $35 monthly cost for your insulin. So you have to be mindful of that. The numbers on Medicare.gov will not be correct, and you may have to do several iterations of going through the process of looking through all the available plans to make sure that your insulin is covered by the plan, and then figure out what the $35 cost would be per prescription for insulin. What I feel is the biggest game changer will happen in 2025 when it limits the out-of-pocket costs for your prescriptions to $2,000. That would be huge for people, but unfortunately, it's not going to take place until 2025. And then the stipulations to have Medicare negotiate some of the Part D drugs. They're only going to do a certain number of drugs per year from 2026 to 2029. So hopefully we can get this all implemented by 2029 and really help people with the cost of their prescriptions. So we are currently in the annual election period, Medicare open enrollment, October 15th through December 7th of every year. This is the chance for everyone on Medicare to review their plans to make sure they're still the best fit for them in 2023. They should review because Medicare, the Part D plans and the Medicare Advantage plans can change what they cover. They can change the list of prescriptions they cover. They can change their network. So it's really important for everyone every year on Medicare to review their options to make sure they're still going to be the best fit for you going forward. And I know I've given you a lot of information, and I'm sure there's lots of questions. So let's go ahead and try to answer them as quickly as we can. Thank you.
Hi, thank you, Lori. That was so informative. Really appreciate your coming and spending the time to talk to everybody. Looking to see if I have any questions. I know it's almost 1 o'clock already, so we don't have too much time. I have, I was like, oh, there's no questions, but there are. I'm just trying to figure out how I see them. Oh, here we go. Okay. Can you still switch Medigap plan level within 30 days notice?
Yes, so in Massachusetts, we can do that. We have what's called continuous open enrollment. So you can switch from one level to the next in Massachusetts. There's no underwriting, there's no problem. We're very fortunate in Massachusetts that we have that flexibility.
Okay. Do original Part A and B Medicare plans have the same kind of referral requirements as HMO plans?
No, they don't. So with Medicare Part A and B, you can go to any doctor that accepts Medicare, any hospital that accepts Medicare. There's no referrals required. Medicare Advantage plans, many of them do have referrals required, and you do have to stay within the network of doctors and hospitals to get your coverage.
Okay. Does enrolling in a Medicare Advantage plan avoid the Medigap underwriting problem should you decide to switch to original Medicare later on?
Yeah, it depends on what state you're in. So yes, a Medicare Advantage plan, they cannot ask you any medical questions. You cannot be denied coverage. You cannot be denied being sold a Medicare Advantage plan. Medigap plans outside of Massachusetts, there's very few states that are similar to Massachusetts, but most other states, if you try to get a Medigap plan outside of your first 6 months of having Medicare Part A and B, you will go through underwriting and they can deny selling you a plan or raise the rates that they offer to you.
Okay. Does Part D review your standing prescriptions, and can it require you to try other prescriptions even if you already have?
Yes, so if you're switching from one Part D plan to another Part D plan and they have step therapy requirement, they can force you to try other medications before they would cover the particular medication that you're looking for. Some people can get help from their doctors. If the doctors document for some reason the other medications, the lower cost medications don't work, you could potentially get the step therapy waived. But many of the plans do have that as a requirement for some of the expensive drugs out there.
Okay. And then how does Medicare work if you have children under the age of 25? In other words, how do your children get insurance coverage? For example, I'll be 65 and my daughter will be 22.
All right, so Medicare is only for people over 65. It's individualized. There's no family Medicare plans. So what in this situation, you would either, the children would go on COBRA for 18 months if they lost coverage because of you going on Medicare, or they can pick up an Affordable Care Act plan or private insurance plan for their own coverage, but they cannot have Medicare.
All right. And then how widely accepted by providers are Part A and B?
So it's very widely accepted by providers. Medicare Part A and B, that's original Medicare. Most doctors in the country cover that. There are some, I've heard of some pockets in Florida, unfortunately, where doctors are saying that they don't take original Medicare. I don't know how that is legal, but I have heard that. But Medicare Part A and Part B is very well covered throughout the country.
Okay. I'm in a Medicare Advantage plan. Does that mean I cannot change to a Medigap plan in Mass?
In Massachusetts, you can change from a Medicare Advantage plan to a Medigap plan. You can only do that though during this time frame, Medicare open enrollment, and it will become effective January 1st. So you would have to enroll in a Medigap supplement plan, having it become effective January 1st, and you would have to enroll in a Part D prescription drug plan, and it would become effective January 1st. So you can go from a Medicare Advantage plan to a Medigap plan in Massachusetts.
Okay. We'll do a few more here. I am self-employed, just turned 65, and under my employed spouse's age 64 health plan with HSA. Is it okay to do nothing now until my spouse retires in 6 to 16 months, assuming we stop making active contributions to HSA 6 months before my spouse's separation from service? Thank you.
Yes. So as long as you're covered by your spouse's employer plan, do not enroll in any part of Medicare, Part A or Part B. Many people, when they turn 65, will, and still working or covered under employer plan, will enroll in Part A of Medicare. Once you enroll in Part A of Medicare, you can no longer contribute to a health savings account. So you can do nothing as far as Medicare enrollment. As long as her employer has more than 20 employees, you do not have to enroll in Medicare. You can continue to contribute to a health savings account, but yes, 6 months prior to when the working, the person that the coverage is through stops working, then you have to stop contributing to a health savings account.
Okay. I was shocked to find out that my Medicare Advantage plan now considers insulin covered under Part B, not Part D, because I use an insulin pump. My cost doubled because now I have to pay co-insurance, not a co-payment. Mm-hmm. Would this be the same if I had a Medicare Part D plan and not a Medicare Advantage plan?
So it's not some insulins, especially insulin pumps, are covered under Part B of Medicare. So they still would not be covered by Part D of Medicare, the prescription drug coverage. But what you could do is get the Medigap supplement plan, because the Medigap plan would cover that 20% of Part B that Medicare doesn't cover. So having original Medicare, Part A and B, Part B would cover 80% of the insulin for the insulin pump. The Medigap plan would cover the remaining 20% for the insulin. So that would give you more comprehensive coverage versus the Medicare Advantage plan.
Okay. If you return to work while on Medicare, can you pause Medicare?
Yes, yes. So as long as there's more than 20 employees and you're covered by the employer health care plan, you can disenroll from Medicare Part B. You cannot disenroll from Medicare Part A. So you won't be able to contribute to a health savings account, but you can disenroll from Medicare Part B. You would have to reach out to Social Security and they would want to interview you to make sure that that's truly what you want to do, but it can be done and has been done.
Okay. If your income changes after enrollment in any of these plans, Medicare Advantage or Medigap plans, are the premiums revisited regularly or at all?
So the premiums for the Medigap plans and the Medicare Advantage plans are not, do not fluctuate based on your income. It's the Part B deductible that is based on your income. So if you retire, there are certain qualifying events, and one of them, you know, if you retire, if you have a reduction in income, then you can reach out to Social Security and have them redetermine your Part B premium to potentially reduce the amount to the standard Part B premium of 170.10 in 2022.
Okay, one is a question whether this is being recorded and whether it will be sent to participants. I believe the answer to that is yes. I'll just confirm that with Beth.
Yes, it's being recorded.
Thanks, Beth. Let's see. Medigap must be enrolled within the first 6 months to avoid complications or restrictions. Is that correct?
That's correct in other states, not in Massachusetts. Massachusetts, we have continuous open enrollment. You can enroll once you're become Medicare eligible Part A and B, or if you decided to go with a Medicare Advantage plan for your first year and then you want to switch over to a Medigap plan in Massachusetts, we can do that at any time.
All right. My Medicare Advantage plan claims to provide travel coverage for urgent care. Is that misleading?
No. So the Medicare Advantage plans do cover outside of your area for emergency or urgent care needs, but you need to contact the companies right away after the event so that they know that you're out of the network. So you are covered for emergency and urgent care. A lot of people who go to, my example is snowbirds to Florida, they're typically out of the area for an extended length of time, and sometimes they want to see a doctor for something that's not considered urgent or emergency care. They would have to pay the full cost because they're out of the network and it's not emergency or urgent care.
Okay. All right. Why don't we just do 2 more? So please clarify, paying Part B premium is required regardless of whether one chooses Medicare Advantage versus Medicare Supplement Medigap.
That's true. Everyone has to pay the Part B premium, no matter if you go a Medicare Supplement route or the Medicare Advantage route.
Sorry, I'm just going to scroll. A lot of these are the same question, like will the slides be available? Someone asked, this is the last question just because we have a lot, then they're still coming in. So we'll, if you do have questions that don't get answered and you want to engage Lori for some help or information, it's here on the slide. So you can either write it down or get it when Beth sends these slides out to the group. So the last one is, what is IRMAA?
So that's IRMA, Income Related Monthly Adjustment Amount. So that's for people who are considered higher income. That's the surcharge that's added to the Part B premium, and the surcharge is added to the prescription drug portion too. So Social Security feels that people who have higher incomes should contribute more to the cost of their Medicare coverage. So they increase the Part B premium and have a Part D surcharge.
Okay, great. Well, thank you very much, Lori. This was super informative. And I know I got a lot out of it. I think everyone else did as well. So thank you for your time. We really appreciate it. And thank you to everyone who attended today. Have a great day.
So wait, sorry, just one more thing. We're not sending out the slides. We're just sending out the video.
Okay. So, okay.
So it'll be, the recording will be sent out in email and also available on our website by next week.
Great.
Thanks. Sorry.
Have a good day, everyone.
Have a great day.